Naturepadam Dental, your perfect dental partner.
I just saw a video about root canals, and it was done by somebody who is not a dentist. She was just a patient, and she was talking about how dangerous root canal treatment is, how she felt bad about a root canal, or she removed some teeth which are there in the mouth, which was root canal treated, and she got rid of fatigue, and she got rid of some issues with their health. And she's been telling that her whole process of demeaning root canal, or telling that root canal is not good at all. She has used some of the scientific researches which was done in 1920, and 1920 is when dentistry was primitive, even medicine was primitive at that time, and I don't know, and the research methodology was even actually very primitive at that time, and she has quoted that to tell that root canal treatment is bad, or root canal treatment can cause diseases in the body, and she claimed to even say that good root canal treatments even can cause even heart disease and stuff like that. And she has over and over she has quoted saying that the tooth is dead and necrotic and all that stuff. We need to look into what exactly is happening in root canal treatment, especially the way she was telling. Let me tell a little bit of historic perspective before we start. In 1920s, my dad is a dentist, and he's still practicing. He has been practicing since 1965. Before that, that is his brother-in-law was a dentist. My uncle is also was also a dentist, so he passed away. He learned dentistry from Chinese dentists. That was the dentistry which was there available at that time, or international dentists were working in our places also. And at that time, even when Daddy was studying in college, they used to talk about arsenic being used for root canal treatments, and there were primitive methods of root canal. Arsenic, as you know, is actually a very bad thing. It's a poison, but it was used for killing the nerves in the thing, and it used to give necrosis across the pulp so that the pain will go. But that was the technology at that time that was very effective, because once a patient comes in, I've heard some of the incidents where I have seen patients having tooth which is root canal with arsenic, having the tooth for more than 30 or 40 years. I have extracted myself, and I have seen that if done in a very particular way, because I've interacted with my uncle who passed away. He told he used to keep fiber of arsenic in the tooth, and it used to be for just one day, so that kills the nerves, because at that time there was not much mechanical devices and x-rays and stuff available to do a good root canal treatment. But that time is over. That time is over. We never use arsenic. We use all arsenic-free stuff in our clinics. We don't use any root canal stuff, like we don't use pulp necrotizing or pulp mummifying agents in our clinics anymore. It used to be used in the past, or if you look at the history of root canals, and if you look at some of the older literature you'll see that people use formaldehyde or formalin and things like that. But nowadays we don't use any of those stuff. So how can you say that some of the older stuff, that is in, if it is, even if you take 1920 or 1930, 40, 60, it is transformed dentistry. What dentistry we are using is computerized technology. We are using much more advanced technology, like lasers to disinfect your canals and stuff. Like antibiotics have also improved much better. Even disinfectants inside the root canal has been improved a lot. We know how to remove the smear level. We know what exactly happens inside the root canal, and it is no more what the lady said, because she has looked into some old stuff. And if you look at even flying, if you look at 1920 flying, I don't know how many will fly in a flight. So it is not about that we have improved much ahead of this thing. So I know I am not saying that she should be taken off or anything, but you, as a person who listens to all these things, you should not take stuff from 100-year-old stuff and then tell that that is research. That is also research. That is why we have moved out of that stuff and we have improved our root canal treatments. Now, another thing was she was talking about the dentinal tubules. It's good that she talked about dentinal tubules, and there is dentinal tubules, and she told that it is like miles long. Yes, it is miles long if you connect everything together. Even if you take a cross section of your what do you call your hair or something like that, and you tell that okay, my hair is miles long, that doesn't make, or add every hair together or like something like that, and you tell that my hair is miles long, it doesn't make any sense, because it's not miles long, it is microns or millimeters long. The tubules are millimeters long, and she is telling that how can you penetrate all those things. See, I'm telling you, if you have a caries in your mouth, see, if you have a bacteria in your mouth, you have normal colonizing bacteria in your mouth, and sometimes our dentinal tubules are like open to this bacteria. If that is the case, we'll have to extract all the teeth. We cannot keep the teeth inside the mouth, because as soon as the dentin gets exposed, there are bacteria which is colonizing that area. And what is the problem then? See, if you have to take out all the teeth, then that is what it is. And I'll tell you one of the reasons or the motives why this kind of videos are coming and getting promoted is because there are people like the implant companies and people who want to extract teeth and put new ones. Like implant companies are one of the largest companies who want to promote such videos so that natural teeth is taken out of people's mouth so that they can put implants. My dear, you are telling that the natural is bad and something artificial is good? Sorry, I have to say that what is God given is God given, and what is natural is much better than what is artificial and kept inside your mouth. Okay, I am not saying that implant is very bad. No, I am not saying that. I am talking about replacing a good tooth which is root canal treated and keeping there just because you somebody told, or some novice or somebody who has not done research telling you that root canal treatment is bad just because she or he has looked into some researches which was done in 1960 or 70 or even 80s, wherein the root canal treatment was done in different techniques. But now the root canal treatments are much more precise, the root canal treatments are much more predictable, and I'll tell you my experience of root canal. I've done more than 20,000 root canal treatments, and we also have failures. See, if you are trying something or if you're doing something, definitely we will have failures. We have failures, but it is less than 0.2%, 0.3% of failures are reported to our clinics. But that is the only thing. See, failures just comes because some treatments are done in a retreated case, wherein somebody has done a root canal which is not properly filled, or it was done using an older technique. Especially in India, we have still people who are using some formaldehyde, some arsenic and stuff, especially in the remote areas, or sometimes which was done some years back. But we do a retreatment of things, we clear it up, and most of the time it gets healed. If it doesn't heal, we take it out and we do put implants or bridges or something like that. So I need to tell you that not all root canals are bad for your health at all. That is very wrong stuff to tell that, because that is like saying that that is just a very wrong thing, because we have technology, we have proper techniques to clean and disinfect so that the teeth can be there. And now let me come to one more part of it. Actually, she called the tooth as dead. Sorry, it is not fully dead, because we just remove the pulp which is infected. It is like you clean up your, what do you call, it is like you are cleaning your ear or something like that which is infected or something like that. It doesn't mean that it is all gone. That is not what it is. It has an innovation from outside. That is why the tooth stays there, because it has periodontal stuff or periodontal structures around it. It has nutrition to some extent. Only thing is why we need to tell this is basically she has categorically said that we remove the infected pulp and things like that, but we don't remove the bacteria fully. My dear, we have periodontal stuff around this thing. We have seen amazing healing happening and the tooth getting completely healed after root canal treatment, and even people having large cyst under that has healed. I have treated people with diabetes, I have treated people with kidney failures, I have treated people who have immunosuppressant drugs with them because of the kidney transplant and things like that. I have my chartered accountant who was treated for cancer, and he was on immunosuppressant and also in drugs like that. And if there was any infection, he or she could have died because of that. So I think that we have, and in the chartered accountant case, I have done more than 20 root canals in his mouth so that to save his teeth and have a great bite and things like that after the radiation and stuff. And he survived with all the tooth and things that he didn't have any other issue. He died of old age recently, so he lived more than 13 years with all the 20 root canals. He never had any other problem. He just died because of old age. So my dear friends who are watching, please don't listen to lies which is being promoted by companies who wants to take out your natural stuff and put artificial stuff. Please don't listen to them. See, if it is required, yes, we'll also put artificial stuff. If it is like a tooth which is broken or pulled out already, so we'll put an artificial stuff, and nothing artificial is as good as your natural one. So if you try to preserve it, try to heal whatever is natural there, that is much better than taking it out just because somebody told, or some research was done, some authentic research was done some years back about some treatment which was done 60 or 40 years back. That is not what it is. We have much better technology. We are looking at scientific breakthroughs every year, and we will make sure that one day even we'll be able to grow tooth and put it in your mouth. So that will be much more natural than the implants what you see. So we will look into the technology, we'll look into the scientific facts rather than just hearing by somebody who wants to promote their video or somebody who wants to promote their stuff online. Sorry, I have to tell this because I have seen and I've been forwarded so many videos about root canals, which is based upon just some very old scientific data. That the scientific data was true. That is why we evolved and we got much better technology. We thank the authors of those scientific data, because that is why we have been guided to do much better root canal treatment. Now we have we are now guided by radiology, that is actually the x-rays and stuff. We also have predictable antibiotics and cleaning agents inside the canals. We have a lot of lasers which is coming for people who need much more disinfection. We are having predictable root canal treatments. Endodontics has really become really big. It is, as she said, yes, it is making a lot of money because people still have teeth, which is, I have personally treated people around 20 years back, and they come every year. They don't have any problem with the tooth. I have international patients. I have patients from 48 countries who have done root canal treatments with me, and if there was any other issues, I could have known. And I've been doing this for 20 years. Please don't listen to people like that. People are fooling you around. Please don't listen to them. They have an agenda behind it. There are companies which is promoting it. That is why it is reaching you. So don't listen to them. It is good for you to keep the natural than to go for artificial stuff. Thank you very much. Have a great and wonderful smiling year ahead of you. God bless you.
Nature Padam Dental, your perfect dental partner.
Sweet perfect smile, nature bottom, nature bottom, smile beautifully, smile. beautiful.